looking at barriers for how and where our future doctors get their education and their training. Some members call the medical accreditation process and hiring practices a monopoly, which leaves behind rural and unserved communities.
And one of the key witnesses is based right out of Northwest Pennsylvania. Tonight, our Washington, D.C. correspondent Rachel Knapp has that story.
When America's future doctors apply for residency, they enter a closed market controlled by a single accreditation monopoly.
In a House Judiciary subcommittee, members examined the so-called the match hiring system in the Accreditation Council for Graduate Medical Education, or ACGME. The chairman of the subcommittee says the match has unrivaled competition, wages, and contributes to a doctor shortage. They also claim there's too many issues in our medical system's accreditation process.
Thank you for the opportunity to testify today on a matter of critical national concern.
One of the witnesses called in to testify is none other than Dr. James Lynn, president of Lake Erie College of Osteopathic Medicine Institute for Successful Living.
The current ACGME model, while well-intentioned, has created systemic barriers that disproportionately harm rural communities, limit innovations, and suppress diversity in physician pipeline.
Dr. Lynn testified about LECOM's track record developing our future doctors and the issues about accreditation has on smaller, more rural areas.
LECOM Graduate Medical Education, which has trained over 693 residents since 1977, stands as a case study in how a rigid and monopolistic accreditation system is undermining the health infrastructure of America's smaller communities. Despite a proven track record of producing competent board-certified physicians, 417 of whom remain in practice within a 100-mile radius of Erie, Pennsylvania, our programs are being dismantled not due to deficiencies in quality, but due to arbitrary, urban-centric, inflexible accreditation policies.
Dr. Lynn urged Congress and the Centers for Medicare and Medicaid Services to help reform the accreditation pathway to ensure rural America is not left behind. At the Capitol, Rachel Knapp, Erie News Now.